The member for South West Coast.
Thank you, Deputy Speaker. Our health system is in crisis. Ambulance is in crisis. For the last 2 years, during a health pandemic, we have sat and been locked in our homes for much of that time, being told by our Premier that he was preparing the hospital system so we could cope. So how disturbing is it to have heard last week, that the government, the Andrews Labor government, have cut funding to the 000 emergency call centres. Our fire, our ambulance and our police. Now, I've been hearing all from my colleagues here in Metro Melbourne, but it's happening in the regions as well. Now, we're hearing of people being told that an ambulance won't come and in driving people to the hospital. Now, when I was nursing, one of the main things we were always told, it is completely irresponsible to drive a patient, particularly someone who's got chest pain or bleeding or a major trauma, to the hospital. And this is what people are being told to do. And the reason it's so dangerous and the reason it is so concerning is because people panic when they're behind the wheel and they see the person that they've got there collapsing, losing consciousness, bleeding, in excruciating pain, whatever the situation is, and that causes accidents and more people die. It makes sense. That's why we have an ambulance service. And I will quote someone. I'll refer to the situation that they told me about in a minute. There are certain things we expect, Simon, from Bojangles, who experienced, Bojangles is a restaurant in my region, who experienced a situation where the ambulance wouldn't come. And I was talking to him after this and he said there are certain fundamentals we experience when we pay, that we expect when we pay our tax in Victoria, and they're just not what we're getting anymore. Now, I don't know how many times I am being told about situations, whether it be Nicole from Portland, who was sitting in accident emergency with her son, emailing me, telling me that an ambulance had not come for her child, just so distraught. Then if it's Hannah the nurse from Kirkstall, who was having a postpartum bleed and knew how important it was for her to get to hospital, but the call wouldn't connect. So she would have bled out, and luckily, being a nurse, she knew that. And the only reason she didn't die was because she was a nurse and so was her husband, who drove her to the hospital. And Simon, who I just quoted a minute ago, Simon, who owns a restaurant in Warrnambool, Simon, who had a person collapse and have a fit in the restaurant at Christmas time. He was trying desperately to ring 000 and he got connected to the "do you want ambulance, police or fire?" and he said ambulance, and it rang out. He continued to try. Dave, who was a customer who also told me about this incident, tried ringing as well. One of his staff, luckily, was a nurse. When they finally did get onto the ambulance, it was about an hour and a half all up, this incident. No, I'm not. And the ambulance said, "Get the guy home in a taxi." And the nurse said, "There is no way I am doing that." And she drove him to the hospital. These people in my community were so shocked at this incident. Later that night, Simon spoke to the police and the police said, "Yeah, we heard about what happened. It was pretty awful." So these are the stories that aren't just happening in Metro Melbourne, but they're happening here. And before, when the member for Hawthorn was laughing, and I said, "Come on," because we were saying, you must be getting emails, you must be hearing these stories. Well, my sister lives in your electorate, and in 2017, from being on non-steroid anti-inflammatories, she had a bleed, an internal bleed. She lost consciousness. She was preparing dinner for her children, and it was over an hour. Now, she'd gone past the tachycardia stage, Steve, you'll know what I'm talking about, past the blood pressure dropping to lose consciousness. She was so bradycardic when she reached hospital, she nearly died. So it's happening in Hawthorn. She got an ambulance after an hour and a half, Steve. The member for Melton, through the chair, she got an ambulance after an hour and a half. So these are real stories. These are real stories. Now, I'll move on to waiting lists, because we're hearing story after story, not just in the metro, but right throughout the regions, about how long it is taking people to be able to have surgery. Now, surgery is vital. We have called it elective surgery, but now we're all realising just what elective surgery means. I don't think anyone wants to go under the knife without a good reason. So we don't know how many we've got actually. I can tell you that Warrnambool's gone from 85 days, South West Healthcare's gone from 85 days to 218 days wait list. Now, if you add all the hospitals up, you'll get the answer to how many people there are on the wait list. We knew it was 80,000 in December. We know the hospitals all keep the data, so we know that information's available. But secrecy is a feature of this government. Portland Hospital, which has 9,000 presentations to its urgent care every year, more than Hamilton Hospital, has just had access to a secret report, the Hillis report, that Professor David Hillis wrote in 2020. It's now 2022, and that report has been leaked by someone who's obviously very worried about the situation in Portland. Now, I don't want to, for 1 minute, focus on the fact that it's, distractions. The reality is here, that report says the government has had review after review after review, and this professor said no more reviews until the recommendations that have been in these reports and in the report he had are adopted by the government. And it cannot be done by Portland District Health alone. It has to be government-led. But the government won't show the community what's in that report. I've seen that report. And why? Why should the people of Portland, with an industrial port, an agricultural sector, a forestry sector, have less ability to seek the support they need when they're at least 4 hours from the city, an hour and a half from Melbourne, from Warrnambool, which has got blowing out elective surgery lists as well and pressures on it. That's why we're building a new hospital there. Why should the people of Portland have not the support they need? Why the secrecy? It's not about personalities, or local politics. It's about a government-led situation that the government knows they have to do but want to keep that a secret. Well, the secret's out. So it's time to be transparent with that community and support the people of Portland. I can't believe we in Victoria have just gone through a code brown. We've got an ambulance service that's been cut when we've got the highest demand on the health system and people need them the most. We've got the least funding of the state of Victoria's health system than any other state in Australia, so much so we had to have a code brown called. Now, I nursed in the hospitals for many, many years. I know what a code red is. I know what a code blue is. I know what a code yellow is, purple, black. I'd never heard of a code brown. Probably because no one thought I'd ever need to know about it, so I wasn't taught it, because you just wouldn't think in the state of Victoria that we would be in the crisis we are in now. And I'll quote again Simon Muggervan from Bojangles when he said, Roma, there are certain fundamentals we expect in Victoria, healthcare, ambulance, to dial an ambulance and get an answer and get an ambulance. He waited over an hour and a half while he said, I had to walk over the guy back and forth because I had to still be able to manage the restaurant. He was quite traumatised, as I think you could probably imagine. And then we get to dental waiting lists. Well, 151,500 people are waiting to see a public dental system. And what has the government done about that? What is it now, 19 out of the last 23 years? And we have 151,500 people who are in pain. These are not people wanting to have a checkup. They are people who are in pain, they are struggling, their nutrition is compromised, their health and well-being is compromised because they can't function in excruciating pain. Have you ever had a toothache? I hope not. They're pretty darn hard to treat. They're actually very, very hard to treat with normal analgesics. The best treatment is going to a dentist preventatively and when you have to see the dentist. So I have As you all know, nursed for a very long time, prophylactic medicine was a feature. We are now in a reactive medicine stage and we will take years to recover because this government has not shown the care. They've lied to us. They have told us things that are not true, and now we're finding out the truth. From the Productivity Commission, no less. These are the facts. This is not me saying it. This is the government's failures.
Order. Member's time has expired. The member for Eltham.